Welcome to the HP Plus Family Share Fair breakout session on a multisectoral approach to integrating youth entrepreneurship and sexual and reproductive health in Malawi. My name is Sarah Pennington, and I'm a technical advisor in Palladium's health practice. And before we jump in, I'd like to ask you all to take a few moments and think about what young people need to succeed in life and what are some factors that can empower youth to become leaders. If you could type your responses in the chat, please. Support from a friendly adult, that's great, yeah. Information, skills, and access to opportunities, absolutely. Some of you may be familiar with the Positive Youth Development Framework. PYD is a philosophy and a programmatic approach that engages youth along with their families, communities, and/or governments to empower youth to reach their full potential. PYD approaches build skills, assets, and competencies, foster healthy relationships, strengthen the environment, and transform systems. The idea is that youth with more developmental assets are more likely to enjoy academic success, have greater economic prospects, be more civically engaged, and be healthier in the long term. So I think we see that some of the ideas from the chat are reflected in one or more of these domains. Some background about our activity. So Malawi's Youth-Friendly Health Services, or YFHS strategy from 2015 to 2020, prioritized youth health and economic development, among other areas such as education and social protection, to engage its youthful population. 80% of Malawians are under the age of 35, and take a holistic approach to contribute toward achieving the demographic dividend. HP Plus supported multisectoral engagement by collaborating with the Ministries of Youth, Gender, Education, and Health at national and at district level, as well as groups of parents, teachers, community, traditional leaders, and of course the youth themselves in 3 communities in Mangochi district to roll out the YFHS strategy. Our initial objective was to translate and pilot implementation of this national strategy at a grassroots level and demonstrate how policies can come to life rather than sitting on a shelf. While some of our participants may have heard of the strategy, very few at the local level were aware of what it contained. So in 2017, HP Plus facilitated workshops for diverse groups within these 3 communities to inform them about what the YFHS strategy outlines for youth regarding rights and access to family planning. Our participants then developed and implemented action plans to improve youth access to and uptake of health services and address other challenges like early marriage, teen pregnancy, and school dropout. HP Plus conducted routine monitoring visits to check in on our group's progress and help troubleshoot challenges. One consistent piece of feedback we got from the youth was that they wanted to do more outreach to their peers, but lack of budget to implement their action plans was a constraining factor. So in response to this request, with USAID support, HP Plus Malawi partnered with Palladium's Feed the Future Malawi Ag Diversification Activity, or AGDIV, to deliver the Gender Action Learning System, or GALS, and entrepreneurship trainings to youth clubs. Following these trainings, we continued to provide routine monitoring, TA, and mentorship. From June of 2019 through December of 2021, HP Plus and AGDIV supported youth clubs to implement their business plans in addition to their health policy advocacy plans. The youth clubs committed to investing a percentage of their profits from their business into continuing to improve access to YFHS in their communities. HP Plus also supported youth clubs to apply for external funding opportunities and connect with business leaders and district government officials to obtain the required trainings for certification and to become eligible for business expansion and other initiatives and opportunities. So we would categorize the results from this activity into 2 sort of buckets or areas. So following the original workshops, as you can see from the graphic at the bottom of the slide, youth uptake of YFHS increased over the year following the action plan implementation. In particular, we saw large increases in the number of youth accessing information and counseling on YFHS and family planning, as well as male condoms and HIV tests. We also saw communities tackling challenges to end those child marriages, finding resources to pay for student school fees, and investing in building or improving menstrual hygiene facilities to help girls stay in school, among other interventions. And then the second phase, following gals in business development and entrepreneurship support, also garnered impressive results. Youth clubs increased their profits and investments and continued to funnel a portion into YFHS, including building youth corners, which are physical structures where youth can access FP services and commodities, supporting family planning coordinators to conduct limited outreach, purchasing motorcycles and bicycles to loan out to rural youth to access YFHS sites, and also to generate income as taxis for the community when not in use by youth, bringing girls back from early marriages and raising tuition money to send them back to school. Youth clubs took the initiative further to cascade the GALS curriculum and use their own resources to orient other youth clubs, taking the total number of youth clubs conducting social enterprises such as beekeeping, maize, and goat farming from the initial 15 clubs that we trained to 29 clubs in total. 10 of these youth clubs then worked together to form the Tema Honey Youth Producers and Marketing Cooperative Society, which is the first youth-led, youth-centered cooperative in Mangochi. As a cooperative, they were able to pool their resources to increase the quality of the honey that they produced and sell it at higher cost in places where people tend to purchase it, like pharmacies. Just 3 months after being registered, the cooperative secured a $56,500 grant from a World Bank financing project called Agricultural Commercialization to continue to grow their honey production business. HP Plus and Feed the Future continued to support the growth and capacity development of these clubs and the cooperative, which are still investing a portion of their revenue into YFHS. So some of our lessons from this activity are that we really did find that it contributed to all 4 domains of the Positive Youth Development Framework. Mangochi youth are leading and expanding the program in various innovative ways. They have the necessary resources and skills to achieve their desired outcomes. They can employ their assets and aspirations to make their own decisions about their lives and set their own goals and act on those decisions. They are surrounded by an enabling environment that maximizes their assets, agency, access to services and opportunities, and their ability to avoid risks. And they're encouraged, recognized, and able to be involved in and lead through various channels as a source of change for their own and their community's positive development. One of the reasons this was so successful is because HP Plus and USAID were flexible enough to adapt the program based on feedback from the youth and had the connections to provide the tools, support, and those linkages to the community and business leaders and government officials to strengthen that capacity. We offered technical support as they applied for more resources to continue to grow. HP Plus simultaneously focused on youth engagement at the community level and interministerial collaboration at the district level, while ensuring that results were also being reported up to the national level. The engagement of the relevant ministry teams and community leaders supported mutually reinforcing activities towards a common agenda, shared measurement systems, and continuous communication. This engagement at all levels contributes to the likelihood that gains achieved during the program can be sustained, as the ministry team, community leaders, and youth themselves are invested in its continued success and understand their roles. YFHS uptake increased as communities came together to address challenges of forced and child marriage, teen pregnancy, and school dropout. The holistic approach to improving FP service uptake looked at not only whether youth know about and understand how and why they should use these services, but at what other factors might influence the enabling environment and contribute to SRH outcomes. Rather than working in silos, it would behoove more development partners to integrate their FP activities targeting youth with interventions that help youth develop agency and leadership skills and strengthen their enabling environment. So thank you, and I will take any questions and then we can have a discussion. Feel free to take yourself off mute or type in the chat. Do we have any questions? Amy. Go ahead. Amy, I see your hand up, and I don't believe you're on mute. Do you want to type in the chat if you're having trouble connecting? I cannot hear you. Okay. Yes, others can come forward if there are any questions.
Hi, Sarah. This is Sarah Stratton while Amy is typing. I'm curious, sort of what kind of objections, I'll say, you might have encountered from adults in the community, and curious how you all address those.
Yeah, I think early on, there were some objections in the initial phase of the workshops to explain and sort of translate what the YFHS strategy included about access to SRH and information. Some of the parents and teachers, I think, were a bit reluctant to have that kind of conversation, thinking that access to information about how to have safe sex could lead to more sex. One of the key factors that we found it was successful in sort of overcoming that resistance was tapping into local religious leaders to help us facilitate those workshops. So we had a very strong connection already with religious leaders in the community, and one of the co-facilitators was a Muslim leader, and he was able to make the point that better stewardship of resources includes being safe and protecting yourselves. I think that was one of the main ones about the community level. I don't remember there being any specific objections about the entrepreneurship training. I think there's been a lot of support, especially from the district level ministry, in seeing those clubs grow. Amy says, great presentation, thank you. This seems like a true representation of PYD. It is great to see the application of multiple domains and the collaboration across multiple sectors. I'm curious what the short and long-term goals and results are on the health system outside of the increased uptake of YFHS. What are the goals in this space as youth age and new youth join? That's a great question. I think that there are many applications of this, and that we're seeing these youth clubs really take the skills that they've learned and go in all sorts of innovative directions. I think that there will be results on the health system beyond YFHS, and also on the economic growth of these youth as they, as you say, age out and new youth join. I think one of our goals that we are seeing happen is this capacity cascade as the youth clubs are training each other. So even as some of the youth age out and go on to fulfill their professional goals, they're leaving behind a legacy of other youth who are able to continue that work and training each other, which is really exciting. I don't know that there are specific health areas that are being that they're focusing on right now. We kind of married the two, the YFHS family planning side with the entrepreneurship side, and had them commit to putting a proportion of their profits into the youth-friendly health services. But there's nothing to say that they couldn't put a portion of their profits into other health areas too. This was the focus of our work. Maybe Sandra, who is on the line and helped implement this in country, you have something to add?
Thanks, Sarah. I think you've summed it up in terms of the investments in different health areas. We had really married it to the YFHS, so that's including HIV and family planning. The most that we've seen post the project is that they're going into social services, kind of using the same model for child protection mechanisms. So that's what we're seeing now.
Thank you. Yeah, that's great. So if you've worked with youth, oh, you have another, let me see. Benefit sometimes of uptake and services when projects are ongoing and there's intention. This doesn't necessarily sustain when the project goes away. Yeah, I wish you could talk too. Could the youth help influence policy and financing? Yes. So that reminds me of another point I wanted to add if we had time, which is that this is not the only intervention that HP Plus Malawi was doing with youth and policy and financing. We also trained youth champions in policy advocacy. We've done a lot of financing training for these youth and other youth. So yeah, I think this whole generation that we're working with, especially in Mangochi, but in other districts as well, is sort of building this base, this capacity to do other long-term systemic change. Yeah, and I think the sustainability as the project ends is something that we've really been focusing on, in particular by tapping into community leaders, district leaders, and that multisectoral government, the district level ministry team. The purpose of having them engaged in part was because we wanted this to continue on past HP Plus. And so it created this accountability mechanism where if the youth advisor couldn't be there, and then the health advisor and the gender advisor would, sort of tag team and work together to make sure that they were participating in the monitoring and supporting the youth clubs. And Sarah is pointing out that under Momentum, which is just kickstarting now, some of this will continue. Go ahead, Sarah, or Sandra, rather.
So Sarah, just to add, USAID had a mission 2 weeks ago, and they visited the cooperatives, and this is like 3 months after we've left or 4 months after we've left the project, and they found them still running, as you said, under the guide of the trade district officer there. So they're still functioning. So the sustainability arm seems to be working there. And from the other projects, we see the young people are still active on the policy scene. They are accessing grants from the trainings, and they're continuing on their work without us. So it's a good sign.
That's a really good sign. I also wanted to mention one of the comments that we got from early on in the rollout of the workshops on YFHS implementation, that the community groups that were implementing their action plans really felt committed to continuing to work because they knew that we were coming back to monitor. So they said that, some other development partners or implementing partners would do a training and then just kind of go away. But because they knew HP Plus was coming back every quarter at least, and wanting to hear how it's going and provide technical support to troubleshoot challenges, that really motivated them to continue. So I think that's another success factor to highlight. Sandra can answer this question from Amy about contributions to the health sector.
So yes, that was another thing that I think was asked during the time, and they were able to produce their records in terms of how much they were producing, still giving towards the YFHS Center, and some of the funding they're still using for outreach for YFHS coordinators to reach young people. So it seems to be a good model, and that they're engaged, I guess, because they're making money on one side, but that they're also able to plow this back.
Yeah, absolutely. Great. So